What can you tell me about pain?
Well, that's a really good question. So one thing I can tell you about pain, and I'm not going to sugarcoat it, is that you will have pain. I would be lying to you if I told you that there's not going to be pain after surgery, so you should expect there to be some degree of pain. However, I will say that it is also one of our primary objectives, if not our primary objective, to do what we can to control your pain after surgery. In general, I'll tell my patients that while we can't get you to a 0 out of 10 amount of pain on a 10-point pain scale, where 10 is the worst amount of pain you could possibly imagine, we really can't get kids to 0 out of 10, but it's our goal to try to get them around 3 to 4 out of 10. And so we'll work with you and your family to do what we can to control your pain and keep it in a place where you can manage it, knowing that in the long term that pain will go away. And frequently, you'll notice it diminish significantly as soon as 10 to 14 days after surgery.
This is a big procedure. We have to go in through your back, move the muscles to the side, and put metal screws and instrumentation into the bones in the back. So naturally your body reacts in a way that says, hey, we don't like this. This is not a normal thing. So some degree of pain and discomfort is to be expected in the initial few days and few weeks after surgery. We have a dedicated team of anesthesiologists and pain management specialists who do our very best to keep that pain in a reasonable and tolerable condition by using a whole different bunch of medications together. Typically, it'd be normal for average patient to be requiring some form of narcotic medicine, a pain type of medicine, for the first week or so after the operation. And typically some form of a lesser degree of a pain medicine like a Tylenol for sometimes several weeks or even a few months after the operation. But the severity as well as the frequency of that pain gets less and less and less frequent the further and further we get out from the operation.
Like scars, pain is part of surgery. We know that. We know it is not 100% avoidable, but we also know we have to take every step possible to keep the pain under control and keep it to a minimum. So, during the surgery, there are steps we can take to put medicine in the wound so that, like going to the dentist, when you first wake up, things are numb. There are medicines we can give you through your IV that will also help. And then there are things that you can do. There are ways that we will teach you to relax, to distract yourself, and not focus so much on the pain. All of those other methods will help you feel better and reduce your need for pain medicines.
So pain after surgery is something that you will encounter and might be unsure of how to deal with, or if you've heard things about it, so you're fearful. But I can tell you that initially after surgery you will have, most patients do have, I should say, a pump that controls their pain medication, so you'll have the ability to press a button when you feel like you need medication without having to ask for it. So that's something that we do initially after surgery, and your nurses will help explain that to you, how it works, how often you can press it. So that is something that you have control over. After the first day or so, we do take the pain pump medication away, but then that's when the teamwork begins and you really talk with your nurse about how you're feeling. And if I need to get up and walk, I don't feel like I can do that right now. Just having that conversation open and that teamwork there so that we make sure that you get the medication you need to do the things that we're asking. So I think it's kind of hard. A lot of patients haven't had surgery at all before or have never been asked what their pain number is. So you may not have an idea what a 10 is or what a 4 is to you. So I think it's really important just to talk with your nurse about what's tolerable and what you can handle and what you can get up and do so that we can work together to make sure that you heal properly.